Hello, I am your host, Dr. Jack Braha, and welcome to the Medcastplus show. Here on Medcastplus, we bring local healthcare providers and physicians, experts in their field, to help educate us on a number of medical topics. Today we are pleased to have Dr. Tatiana Khrom. Dr. Khrom is a board-certified dermatologist and Mohs surgeon, and she practices here in Brooklyn, New York. Welcome to the show, Dr. Khrom. It's a pleasure to have you.
Thank you for having me.
So before we delve into the wide world of dermatology and skincare and skin health, I'd like you to help us introduce you to our viewers. Tell us about how you became a dermatologist, where you're from, and living here and practicing here in New York City.
Well, I was brought to Brooklyn straight by my family at the tender age of 12 from the former USSR. And I couldn't decide when I went to college which way to go, the liberal arts, law school way versus the medicine way. So I did a double major in biochemistry and philosophy, and science won. Went to medical school and then loved dermatology ever since, and did that. Did all my training at SUNY Downstate and did a procedural dermatology fellowship where I learned to do lasers and skin cancer treatments.
So Dr. Khrom here is an expert in dermatology, and we want to start delving into this world of skin care. Skin is the largest organ on the body. There are many, many diseases that we can suffer from on our skin, but there are also a lot of cosmetic procedures which we'll discuss today, including injections and lasers, all to make us a little bit prettier, happier, better looking on Instagram or in the mirror. And so we'll delve into that right away. Botox, Botox, Botox. We hear about this injection of botulinum toxin, which is a chemical that paralyzes the muscles, basically. And maybe you could tell us a little bit more about what is the chemical that is in Botox? What does it do to our muscles?
Well, it basically interrupts the signal between muscle and nerve. And by breaking the signal, it actually allows us to look happy, where we are actually not frowning for a period of 3 to 6 months. And we use this to our advantage to prevent the deepening of the 11 lines, as you know, the horizontal creases across our forehead, and there is no pathological injection to the body. It's basically the part that just interrupts the signal between muscle and nerve.
So if someone comes into the office and they're concerned about some creases and they'd like to have Botox to relax these areas, is there anyone who is not a candidate for Botox? Is there someone who can't have Botox for any reason?
The only people who we don't administer this wonderful medication to are people with some muscle disorders such as myasthenia gravis or something like that, which is a very rare occurrence.
So most people are a candidate for Botox. What are some of the most common sites of the face or body that you've been injecting lately?
So the FDA-approved sites for Botox in particular are the 11s, which are the 2 creases that we make when we try to frown, the horizontal lines across our forehead, and the little crow's feet, which are lines of squinting, if you will.
So everything I'm seeing in the morning in the mirror when I wake up. Okay, so you can fix me. I can look 29 again. We talked about some of the on-label indications. These are the things that the FDA has approved the injection for. But what are some of the newer horizons for this injection for Botox? What are some of the new areas that you're seeing maybe dermatologists venture into, some of the off-label uses that we're using them for now?
Sure. So we all love a very sharp jawline and a beautiful neck. So named after the Queen Nefertiti, we frequently perform the Nefertiti lift, where we actually inject Botox into the platysma muscle, which is a thin muscle basically spanning this area of our neck. This relaxes the bands of the muscle and gives us a very nice and sharp jawline, which is basically what everyone wants to get.
Right.
Sometimes we use it for thinning of the face, giving a heart-shaped appearance for women, and that's injected basically into hypertrophied muscles of mastication or chewing.
The chewing muscles we could.
The chewing muscles. So,
can you still eat after this happens?
So if you enjoy a large burger, you may find your bite to be slightly weaker, but other than that, people enjoy it a lot. And coming to us from Asia, we enjoy actually slimming the calf muscles. So if someone has a hypertrophied calf, either for genetic reasons or because they love doing a lot of squats,
Okay.
or calf raises. We can slim those too.
So if they were too fit and they want to
Yes.
reduce that calf muscle
Yes,
bulge,
for lean and long, beautiful
interesting.
legs,
Interesting.
sometimes we do that as well.
You are fixing everything, it seems. So you mentioned the term before the show started. We were talking about brow Botox, I think I took it as. Explain to our viewers, what is this other fad or interest that people have in the Botox?
So a lot of men now enjoy looking after themselves, looking very groomed, the metrosexual male, whatever. There are so many different terms that exist. Basically what it is that men usually, typically genetically, have a low brow, and they enjoy having a more open eye appearance, and using the Botox in certain strategic places, we can actually elevate the brow. It's the chemical brow lift, and that's Botox for you.
And that's using the botulism. I can't even pronounce it today. I'm tongue-tied. The Botox
Just
injection.
call it Botox,
Botox
although
is
there
easier.
are 4 FDA-approved
Right.
neuromodulators now
There are
that
different
exist.
brands out there
Correct,
of this
correct.
chemical. That Botox has some cousins out there now that are
Yes.
similar.
Yes.
So you can treat the calves, the neck, the face, the Botox, which I just found out I need to buy, and lift my eyes for all our viewers. You'll see more of my face soon, possibly, which I know is probably not a good thing. But it seems as though this is very popular. Are you seeing more men, more women? Is it equalizing?
So still the predominant patient in my office is a female, but either due to social media or due to a lot of millennials wanting to do preventative things, take care of themselves earlier, preserve their looks, there's definitely an increase in the male patient as well, and they feel more comfortable coming into the office. But definitely the social media has increased people's awareness and made it okay for people to come in seeking these procedures.
I think we see our faces a lot more than we used to because of
Absolutely,
selfies, right?
and with all the filters, and
Facebook
everyone
and
is
Insta, yeah.
is chasing this perfect filtered look.
We're all seeking perfection, which is a good thing. I think that keeps people maybe eating better, exercising
As
more.
long we as physicians keep our patients in check and educate them about, what's beneficial for them versus what's perfect. We don't want to develop this body dysmorphic disorder of the
Right, right.
perfect selfie face. So just as long as we are honest with ourselves and our patients, I think we're okay.
Yeah, it's a challenge,
Yeah.
as we always were taught at some, in medical school and surgery, and I remember being on plastic surgery rotation that, the enemy of the good is the great, trying to get that
Absolutely.
too much of perfect. But it seems like you're able to use a very simple injection to make people feel better, look better, and with minimal side effects, correct? There
Correct.
are very rare side effects to this?
Absolutely. In our practice, first of all, you have to seek an expert in the field, someone who knows the anatomy, makes the injection safe. And also, if someone wants to give you a very natural look versus what's popularized sometimes in the media, as long as we take an 8 and make them a 10, and not just blow something up on their face that they're asking for, I think we're in good shape.
Yeah, and you brought up a very important piece right there for the viewers to know. Seek out a board-certified, someone who's trained in this, who went to medical school, who can really help you and judge, what you need and what's safe, as opposed to just looking to get payment for something. And that's an important point. We talked a bit about this cosmetic treatment that you have, Botox, to make us look better, and then you mentioned prevention. So I'm going to transition a little bit because it is still summertime, and I know I was out in the sun today a little bit, which is enjoyable and fun, and we all get that nice little glowing tan that's natural. But that could be damaging to our skin, right?
Absolutely. I actually ran out of my office today because I finished a big procedure. I'm also a Mohs surgeon, which means
that's a tedious, long
take care
procedure,
of skin cancer.
right?
So I had a patient today who's elderly, but she had a very large basal cell carcinoma that we removed in 3 stages and basically took half of her cheek off. And that was the result of all the sun damage she accrued as she was young, growing up in Brighton Beach. And definitely I educate my patients, every one of them, on the importance of sunscreen. And now we have wonderful antioxidants and things that we can do and put on our faces that actually will repair the sun damage or prevent it.
So aside from just using sunscreen, because I think we've all been, hit over the head 1,000 times to wear our sunscreen, and if we choose not to, that's just a huge mistake. But assuming that, someone wore, the proper sunscreen in the sun, what are some of the healing treatments or things they can do that are reparative to the skin after a weekend in the sun?
So right now, as we're entering the fall, is the time to start doing these reparative procedures, and this could be a combination of in-office procedures in addition to your home regimen, where we do some chemical peels to lift up all the brown spots, which is basically the sign of sun damage accrued, turn the skin over, do some laser procedures, which again will help turn the skin over, build some new collagen, and repair the sun damage accrued, in addition to doing some cosmetic treatments such as photofacials that would treat the broken blood vessels, the brown spots. So these are all things to start doing now to be ready for Christmas, New Year's, Hanukkah.
The next vacation.
The next vacation, and then it will help you remember.
So there is more to it than just the sunscreen. That those sunspots can still occur, and some of these damages that we can get in our face, you can help, sort of the repair in the office.
Absolutely.
You mentioned Mohs surgery, and I know back, I haven't seen Mohs surgery in years, but I remember it being a long procedure where you take little pieces and go deeper and deeper till you're free of cancer.
Right.
Describe for the viewers, because skin cancer is the most common cancer.
It is.
Skin cancer will affect, I think the statistic is 1 in 5 Americans. It's a very common cancer. So for our viewers out there, if you've heard about lung cancer and you've heard about colon cancer, the skin is still the most common. What is this procedure called the Mohs procedure?
So basically it was developed by Dr. Frederick Mohs, and we use it for areas of the body which don't give us the luxury of take a big chunk out. So we try to preserve the most healthy skin that we can, and we reserve this procedure where basically skin cancer is removed a piece at a time in an area that is sensitive, such as the face, the fingers, the genital area, believe it or not.
To remove only as much as you really need
Removing
to.
slivers of skin that are checked in the office. Everything is done under local anesthesia. And removing, like I said, these slivers of skin, preparing frozen sections, putting them on microscope slides, and then us surgeons checking them, making sure that all the pathological cells have been removed and the healthy tissue has been preserved. And then we do the stitching to make sure that the area is preserved beautifully, and the patient is free to go that same day.
So patients can do this in the office under local?
They don't have to be put under, and they have the security of mind that their cancer has been removed.
With minimal damage, as little as possible.
As little as possible.
There's always going to be something, right, to remove, but not a big chunk like you said.
The skin cancers that we remove, they vary in size. So usually, we're dealing with pretty small lesions, but occasionally something neglected, like I had today in my office, will take multiple stages to remove and will take a large amount of skin off. So like I said today, my patient lost nearly half of her cheek.